Thanks, Ashley. 3.4 million people live with epilepsy in the United States, and November is National Epilepsy Awareness Month, an entire month dedicated to providing support for those coping with epilepsies and spreading knowledge on what it means to experience seizures. Joining us today to talk about the importance of epilepsy awareness and the challenges is Dr. Gabriel Martz, director of the Epilepsy Center at Hartford Healthcare's Eyer Neuroscience Institute. Doctor, welcome.
Hi, thank you.
So can you tell us what exactly is epilepsy and what are the main causes?
Epilepsy is when your brain has learned how to make seizures by itself. And so people with epilepsy experience seizures over time that aren't caused by anything other than their brain being able to do that. And it can be caused by any kind of injury or any feature about your brain that led to do that. So it could be a trauma, it could be a genetic difference that allows the circuits of your brain to create these seizure circuits instead of normal circuits.
And doctor, how is epilepsy usually diagnosed?
It's diagnosed when people come tell us what they're experiencing. The main way we diagnose it is by listening to the patient and learning what they're having as a seizure. They may have a variety of symptoms, and if there are things that we know to be common symptoms of seizures, then we can pretty much make that diagnosis just by meeting them. We do use other tests like imaging tests of the brain, an MRI or a CT scan, EEG, which is looking at the brain waves that we can record. Those things are helpful, but mostly it's listening to people tell us what they're experiencing.
All right, doctor, talk about some of the challenges that people living with epilepsy experience.
Yeah, it can be very challenging for some people. Seizures can be a big issue, and that can lead to being unable to drive by law. In addition, some people may have learning challenges or memory challenges. You add all those kinds of things up, we see that as a group, people with epilepsy are less likely to finish high school or college, less likely to get married, less likely to have jobs, less likely to be insured for health insurance. And all those things really cause a lot of problems, as you can imagine. So when we provide care for people, we're not only trying to stop the seizures, we're also trying to figure out what challenges they're facing. And in a comprehensive epilepsy center like ours and like many around the country, we're focused on all of those pieces of life because we want to get them back to work. We want to get them having the family they're striving for, whatever their goals are in life.
And Dr. Martz, is epilepsy treatable?
Yeah, luckily, yes. Most people do very well with medicines, and we can prohibit seizures from occurring. But when that's not the case, we have surgical options as well. And while brain surgery might sound scary to people, we deal with it every day. We're very safe in how we apply it and in whom we recommend it. And in some cases, it can actually cure people of epilepsy, and they don't have seizures anymore. So we definitely have a wide range of treatments. We want to meet you and talk not only about the seizure treatments, but like I said, the other pieces of care that go into making your life really the best it can be.
A lot of options. All right, Dr. Gabriel Martz, thank you so much for bringing us the latest on epilepsy today.
And thanks for having me.